As we've discussed, relapse is often part of a recovery process. And while it may provoke anxiety to think about your child's relapsing, it's important to be prepared so you can help your child get back to the road to recovery. So in this video, we'll discuss the planning for a possible relapse. While your child is on the road to recovery, I recommend collaborating with them to create a relapse plan. Doing this together can help you empower your child to make constructive decisions about their future. The goal of relapse planning is to document boundaries and expectations. Relapse planning can also increase your child's willingness to participate in treatment decisions and to accept the boundaries that will help them maintain their recovery. Relapse plans might include ongoing follow-up with a counselor or substance use disorder specialist to evaluate your child regularly, even while sober. This will help recognize and detect signs of potential relapse. Follow-up may also include drug testing and enforcement of behavioral contracts. Another part of the plan might include ongoing attendance at support groups that may help bolster a recovery lifestyle and change your child's social network for the better. If your child stops attending meetings, pay attention. This may be an indication that they are thinking about using again. And finally, you should know the treatment options to implement in the event of a relapse. If your child did well in a treatment setting in the past, you may want to consider doing that again. Or, depending on the situation, you might want to try a different approach. Start with asking your child's counselor which level of care makes sense. I strongly advise you to get professional help in planning for a possible relapse. Document the boundaries and expectations together with the help of an addiction expert or family therapist. They can support you and your child in developing a behavioral contract that is appropriate for your family. I want to leave you with this reminder. Your child is probably going to have setbacks. It's best to recognize that setbacks can be meaningful learning experiences to help your child achieve long-term recovery. Plan for relapse so you're prepared if it happens. And if it does happen, don't be ashamed. Understand that relapse is a part of your child's recovery process.